Hello, everyone, and welcome to our celebration of Men's Health Month. This week, our topic is rotator cuff injury. Okay, the first most common question that I usually get regarding rotator cuff is what is it exactly? Okay, and I have our model here to show you and depict that. Okay, so our rotator cuff, this is our shoulder, this is the front, that would be the back. Okay, this band of tissue here, that's our rotator cuff. Okay, and so the rotator cuff is actually a tendon that surrounds the shoulder, and it's made up of four different muscles. We got our supraspinatus, infraspinatus, teres minor, and our subscapularis. All four of these muscles come together to form our rotator cuff. As you can see, it completely encompasses the ball of our shoulder socket, so it provides a lot of dynamic stability to the shoulder. It helps keep our shoulder in place when we're doing things such as lifting, moving, and throwing objects. It also helps move our shoulder in certain directions, such as rotation and lifting our shoulder overhead. Another common question that we get for a rotator cuff is what can cause it to get injured? And we kind of have two different kinds of injuries or tears within the rotator cuff. A degenerative tear, which is most common, and then an acute tear. So a degenerative tear is what we kind of think of as wear and tear over time. But why does this happen and what causes that? So one thing that can cause it is what we hear of impingement sign on the shoulder. Okay, and I'll kind of depict that here. So our rotator cuff actually runs underneath our AC joint, we call our subacromial space. Okay, so what can happen is this tendon can rub on our acromion process right here repetitively over time, which would lead to breakdown of the tendon. Okay, so we're lifting overhead, we're doing activities, it's rubbing on the bone. Eventually, it will cause some splaying of our rotator cuff right here. Okay, so that's one way we can get the degenerative tear. Another way we can get it is just by the overuse. And so we are constantly breaking down our tissue as we're using it. So as we're using our rotator cuff for daily activities, we're breaking it down, but our body heals itself. Unfortunately, as we get older, our body becomes worse at healing itself. So if we're overusing it and not giving it the adequate recovery time, that can lead to it as well. Now, acute injury is a little bit different, right? So this is like someone that, what usually leads to this is someone that would fall on an outstretched arm, called a foosh injury. They lift something really heavy, such as a shopping bag off of a carousel, like when they're traveling, or someone goes to catch something or someone if they've fallen off of a ladder. So this is acute overload of the tissue, which will cause the rupture of it and the tearing of the rotator cuff. Another question that we will get is, can a rotator cuff injury get better without surgery? And it's kind of a loaded question, but the short answer is yes. But that can be very dependent on what type of tear and how bad the tear is. So we like to think that degenerative tears will do better with physical therapy than acute. That makes sense, right? Wear and tear over time is more correctable than an acute rupture of the tendon. But most importantly, whether it's acute or degenerative, it depends on how bad the tear really is and how dysfunctional our shoulder is because of the tear. So when we look at a rotator cuff, okay, we think that partial thickness, small tears do much better. Makes sense, right? We have a small tear here, right? That body can eventually, our body will eventually heal itself down, scar down, and that'll heal. Okay, but now if we have a full thickness tear, meaning it's all the way to the bone, if it rips off the bone, or if it's this whole distance, we tend to do worse with physical therapy, and surgery may be the only option at that point. What is incredibly important about that is the length of time since the injury. Okay, so if you start noticing shoulder pain, you don't want to let it go on very long, because we know if it's been going on for over 6 months, the tear, the prognosis becomes much poorer for physical therapy and surgery. So the key there is, once you start noticing shoulder pain, get into your primary care, get into your physical therapist right away, and get an evaluation and treatment going. That way we can prevent it from getting any worse, and we can make sure and get you the best outcome you can have. Our last question we have is, can a rotator cuff be the only thing that causes shoulder pain? And the answer is no. It's probably the most common pain in the shoulder is due to the rotator cuff, but there's lots of other things that can be causing shoulder pain. This includes our labrum, which is the cartilage that lies deep in our shoulder. We can have shoulder arthritis, kind of depending on our age. We can also have bursitis in our shoulder. So there's a little bursa that lies between our rotator cuff and in that subacromial space that I showed you before that can become inflamed. We can also get some trigger point referrals from some of our shoulder and scapular muscles. Okay, so this is our upper trapezius, and our levator can cause some referral pain down there. And lastly, we can get some actually referral pain from our neck. Okay, so whether it be a compressed nerve in our neck, or if a set joint irritation, that can refer pain into the shoulder and the rotator cuff region as well. This is why it is really important to get a thorough evaluation from your physical therapist if you're having shoulder pain, and not just to assume that it's a rotator cuff injury, because obviously all those different injuries will be treated completely differently. And if you treat it like a blanket rotator cuff tear with some stretches or exercises you found off the internet, there's a good chance that you won't get any better, and you could actually potentially make it worse. So if you're having some shoulder pain, make sure and get in with your physical therapist and get an evaluation to make sure you know where it's coming from, so you get your healing on the right track.